Lord Mayor, I move the motion as set out in the papers. Lord Mayor, I gave a brief overview last month about the situation at Heartlands, but I think the opportunity is given that we do need as a City Council to put our case forward. Lord Mayor, it's 3 years more or less to the day when I was taken into Heartlands Hospital on a non-elective basis. And over 2 months, I had a further admission to the QE, and I'd had a hip replacement as well, which was not bad going in 2 months. But it gave me an overview of what was happening in our emergency units at both Heartlands and the QE. As I said at the last meeting, my examination at Heartlands took place in a storeroom. And I can tell you it was painful. On the 1st of May, Health and Social Care Scrutiny made a visit to Good Hope, Heartlands and the QE. I, along with Councillors Brown, Moore, Bano and Pritchard, went round the A&E emergency unit. Now it's divided into two at Heartlands. The ambulance patients are usually queued up and then one by one taken in. If you are the walking wounded, you go to the left. And when we visited, I think I'm correct, Councillor Moore, there were queues outside, waiting to get in to the waiting room, waiting then to be triaged. And it's mainly because they can't get a GP's appointment as far as the walking wounded are concerned. Heartland serves an area which includes not only North Solihull, but Solihull town itself, and the whole of East Birmingham. So you're talking about a catchment area of around about 400,000 people. And they're solely dependent upon the emergency unit at Heartlands. And we are poorly served, particularly on the east of the city, not by GPs, but their availability to give appointments. While we were going round, it was plainly obvious that the unit was unfit for purpose. You'd got dedicated staff running around, trying to attend to patients, but it was in corridors, inadequate facilities. Now, if I compare that, Lord Mayor, to when I managed to fall downstairs having had my hip replaced and fractured my pelvis, I went into the QE. And it really was chalk and cheese, because there you'd got a purpose-built emergency unit. And the people on the west of Birmingham are very lucky that they have such a facility. Now, there are 3 people in this chamber who have had experience of large capital programmes within the NHS. Councillor Wasim with the Metropolitan Hospital, Councillor Albert Bohr, who oversaw the rebuild of the QE, the new QE, having had John Charlton do a lot of the spade work to create the environment in which the hospital could be built. And myself, because I chaired the dental project board that saw the move from by the side of the Children's Hospital to Pebble Mill. But because of that, I know the length of time that it takes to prepare a case by the Trust for a large capital build to get it through the NHS, through the Department of Health, and then get approval by the Treasury. Because with the Treasury, you've got to pass so many tests. And return on capital is one of them. Because there's nothing for free in this world. Because UHB will still have to service the debt for the capital. But it's a problem as far as Heartlands is concerned because it's landlocked. And you are faced with a situation where you've got to keep the car running, but you've also got to replace the gearbox at the same time. You've got to provide the emergency services for 400,000 people and at the same time develop a new emergency unit. Very difficult. It's a landlocked site. But it's got to be done because the health of our citizens are dependent upon it, because we are serving some of the most deprived communities in Birmingham. Lord Mayor, we are very lucky because we have a shortage of nursing and a shortage of care staff. And they're working very, very hard. And one of the problems that we've got, and I know that my colleague Rob Peacock could speak loudly about it, you've got to get that flow of patients from the front door to the back door and out into the community. And at the moment, we haven't got that flow. And unfortunately, it's creating problems with emergency units. Lord Mayor, as I've said, it doesn't matter whether you're young or old, rich or poor, fit or sick, you need the NHS. It is our national religion, I have to say. It brings all communities together, our dependence upon the NHS. Tilsley. And we need that investment at Heartlands. I move, Lord Mayor. Thank you.
Cllr